SKYPEAnxietycenter.com.
I had a couple questions, Jim.
Yes. This is Marguerite, correct?
Yes, you know
hi,
my
Marguerite.
voice.
Yes, you do, yeah.
Everyone knows my voice.
That's right, yeah.
I don't know if that's a good or bad thing.
Actually, I was ready to tell, like, just like the other person, like the Irish guy's voice, I like Margary's voice.
You do. Thank you. Thank you.
Totally,
Hey, Jim. All right. I'm a little over the 2-year mark. I've been with you. And
Look how fast it went.
oh, yeah.
Oh my, not fast at all, I know.
I know. I'm sitting here nodding when you're talking and you're saying it takes a really long time to get over hyperstimulation.
Yeah. Especially when it gets right up to the top range, hey?
Yeah, I was pretty when I finally let myself succumb, and I was pretty geared up.
Yep. Yeah.
And you guys, you did warn me. You said you're going to get really sick now. You and Stacy. But I had a couple of questions, and I know we're kind of getting, but so I eat sugar. I was horribly anorexic my teen years and 20s and even 30s. And so if you're not eating any food, you got to do something because you're going to pass out. So I've really always been seriously addicted to sugar, and which, come to find out from Stacy, this is not uncommon with anxiety. I'm like, Stacy, I'm the poster child. Just go ahead and tell me the truth. But so when I started in with anxiety, or with horrible anxiety, in October 2017 is when this kind of all started. With I started binging, and the binges got harder and harder. And over the last 2 years, actually, doing the anxiety, well, I was bedbound for so long, and anyway, with anxiety, but I had went to different eating disorder specialists, and I finally made a decision. I had went to OA for a couple months back in 2019, but I made a decision after the first year that my eating was out of control, and I was a sugar addict. I mean, I eat sugar like people drink, and because sugar is highly addictive, and highly addictive. And I've gotten educated on sugar, and but anyway, some of the metabolic diseases I have are directly, some of the health problems I have are directly related to the amount of sugar I consume. But do you think I quit eating? No, I don't quit eating. But anyway, I made a decision about 45 days ago. I went back to OA, and my hyperstimulation is down enough that I can actually sit through a meeting, and I do pretty good. But
good job to you. As you know, you've worked hard.
I've worked really hard, Jim.
You sure have.
Thank you so much for everything that you've done, Jim. You've helped me in so many ways. I can't even. My gratitude is immeasurable. I'm so grateful to the Anxiety Center. I would either be, I would probably be dead, because for me, binge eating was a slow, silent suicide. I didn't have enough guts to do it myself. But I didn't want to live the way I was feeling with anxiety and stuff. It's horrible to feel terror. It's horrible. I mean, but anyway, so the people pleasing, I feel great. I've been off sugar. I did have a lot of cravings, but hey, I'm used to working through panic attacks 10 out of 10.
Yep.
So, I'm primed. my sponsor, she's like, Marguerite, you're just really ahead of the curve. I said, well, I've been in intensive therapy and group therapy for 2 years straight. Stacy had to deal with my smart mouth. And anyway, yeah. So the people pleaser. Oh, and also I should include this. I have gastrointestinal problems. Some of it definitely is anxiety driven. The GI doctor, some of it's the things I eat. And some of it might be, I took doxycycline in my 20s, and that can have long lasting effects on your GI system. So anyway, going to OA, doing all that, I'm feeling, when you put on the little, one of the question, I read the question of the day every day, that you post. And one of them, you said, eating a healthy diet can really help with anxiety disorder. And I can say for the first time in my entire life, for the last 30 so days, I've eaten very well. I've eaten 3 meals a day. I'm feeling good. I can definitely, I call alcohol, sugar, and caffeine the unholy trinity of anxiety disorder. But the people pleasing, obviously people, notice what you're doing, and, there's just certain, I've had to set boundaries, and which actually, the one with my son actually went great. And he was really, he said, Mom, you don't have to ever apologize for getting the help you need. And if OA is helping you, keep going. Nice. And because there was a restaurant that he wanted to go to. And I said, that's just not on my GI doctor diet. That's not OA. That's just not for me. And he's like, no problem, Mom, we'll just go to this other one that you can eat at. And it was like, no big deal. Nice. Of course, I make it out to a huge deal, because I have to do that because I'm still in level 2 recovery. But, kind of help me with this just people pleasing. And, I don't want to answer questions about my food. It's just not, my weight is not up for discussion publicly. It just kind of helped me. The people pleasing is huge for me. What are people going to think? How, and then I live in the Midwest, and so they feed you, well, don't you want this pie? Well, I can't have that, Jim, and it's just like, how do I just say, no, thank you, and just let it go?
Well, that would come from boundaries. I'm sure you worked on it with Stacy, correct?
Like constantly. Like right now I'm reading the Safe People book.
Okay, yeah, okay. Because when a person adopts healthy boundaries, you don't have to give a reason for the decisions you make. Like a lot of people pleasers, well, first off, will go to extreme lengths to make sure everybody's happy, which is a lot of work. And then if we want to make our own decisions, we have to provide at least enough reason so that the person we're trying to talk to is convinced. So it puts a lot of pressure on us. Whereas with boundaries, when you have healthy boundaries, you don't have to give a reason for your choices. And so with healthy boundaries, we realize that you're only in charge of you, and you're not in charge of how the person is going to respond to you. So we don't have to make all those accommodations. And so it's not that we become cold people, but we become assertive and let other people behave the way they're going to behave. And that's just how it is. So we don't have to be concerned about what they do. So that's one of the things with boundaries that was big for me, is I don't have to explain myself anymore, and I don't feel the need. And if people are upset because I don't give them reasons, well, that's their issue. They can work through it. And those who will accept me for who I am will fully realize that. And those who won't, then it's probably not a relationship I want to encourage or entertain for a long period of time. And so what I found is by putting healthy boundaries in my life, a lot of the people I really care about have all adjusted and now are actually doing the same thing. They've all been working on boundaries, and they love the freedom in the relationships we have freedom to voice our opinions, freedom to disagree, agree to disagree. It just opens up our relationships to a greater dynamic than trying to make sure everybody was happy. So that's what boundaries can bring, right?
Yeah. And so will the feeling the need to explain and feeling the need to justify, why I'm not eating sugar, and will that go away in time?
Yeah, I think it will, because again, boundaries is so important to live authentically. And with living authentically, we get to choose what we do in our lives, for our benefit. Now, we don't want to become whole people. We don't want to become selfish. We want to be respectful, but we want to be respectful of other people's boundaries, and we can say no to their requests and they can say no to ours. And we're totally good with that. So it frees you to be who you are and live the way you, without justification. And I think the more you work on those, I think you'll get to that place where you can choose for yourself what you want to do and let the chips fall where they may with other people, because they'll adapt, right?
Yeah. And I think probably the childhood trauma, growing up, I could just never, my mother was so volatile, I never knew.
Yeah. Yeah.
She was so abusive and so crazy. And
that's the thing. So we have to look back.
I think some of that plays into it, like
completely. Yeah. But you recognize that it was her unhealthy behavior, not you, right?
Right. Yeah. Mm-hmm.
Because if she was
wrong.
Exactly. Because if she was healthier, she would have treated you differently. And that's the place we want to get to. Healthy people will treat other people in a healthy way. Unhealthy people won't. Those are just a fact. So if you run into someone who's treating you in an unhealthy way, they've got the problem, not you.
And trying to control what others eat or have a say in what others eat is unhealthy.
It is. Now, we can offer opinions, because living authentically, you can offer opinions, you can make suggestions, but they can choose to agree or disagree or, go with them or not. And we should be good with that, because if we're looking for anything else, then we've overstepped our boundary.
So, here's the scenario. I walk into the library and the librarian says, "Marguerite, this might just be real rude, but and might be inappropriate to talk to you about." Well, right there, I should have cut her off. I should have just stopped it right then. But she's like, "It just looks like you've lost weight," and da-da-da-da-da. And that's just totally embarrassed me. And I totally didn't want to have that conversation at the library. I just, then I leave. And I kind of kowtown and I pretend it doesn't hurt my feelings, and I leave feeling upset and dishonest. And then I think, well, how do I handle those situations? Because I live in a very, very small town, and everyone knows everybody, and that kind of a thing. And how do you kind of, I just feel comfortable just saying, "You know what, Jackie, I'm not going to have that conversation right now. I just really need to get my books checked out and get home."
And you can say that if that's how you truly feel. Absolutely. You can be polite and say, "Well, thank you. I appreciate your comments, but I just don't talk about this subject any longer, and it's nice seeing you, but I have to go," and leave it at that.
Yeah.
There's lots of ways to set healthy boundaries without being offensive, but we can still live the life we want, do the things we want to do, but do it in an assertive way that people will respect. Because for a fact that you'll never gain respect if you're a people pleaser. It just doesn't ever happen.
Amen. Yeah. Jim, amen.
Yeah. And so living with healthy boundaries, well, it will challenge some relationships, because a lot of people want us to stay where we are so that they can do whatever they want to do in our lives. But we don't want to stay there. We want to live authentically with healthy boundaries, so we can be free to pick and choose and respond the way we do without having to offer, convincing excuses or whatever. It just makes life way easier and far less anxiety provoking.
And it's such control. It has such, the people pleasing definitely is anxiety making, because I feel so much better eating this way. And I feel good that I'm taking care of myself, and I'm finally, I want to write my GI doctor and be like, hey, I finally did everything you told me to, and I feel great.
Yeah. Yeah. Yeah.
I feel confident, and I feel, even some of those health anxieties have kind of faded away a little bit, because I know I'm doing what I need to be doing for myself.
Yeah.
Does that make sense?
Completely.
I feel like, I mean, that's not to say health issues can definitely come and go, but I know that, I'm doing what I need to do, for myself, and to keep myself well. I mean, for just a short amount of time, I mean, how much better I feel. I feel a lot better. I still have the hyperstimulation. Like right now, my lips are so chapped, and I'm like, oh, this is a new symptom. But I just keep putting lip gloss. I just be putting the Vaseline,
Yep.
But anyway, okay. So let me ask you this. I'm getting to where I can do. It's been a long 2 years, Jim. I still have to contain some of the fears of the things that have happened, if that makes sense.
Yeah.
Over the last 2 years.
Yep.
Like my pup died, Max, and I had, of course, my back pain and all that kicked up, and I hadn't had that in a while. But I figured if you were standing next to me, Jim, you'd say, well, Marguerite, get a little stressor, and it's your body. When you write, you say your body will kick up a fuss. How do you say that? I figured that's what if you were standing next to me, you would say your body's going to kick up a fuss. You're missing Max. You're grieving.
Yeah.
Your little weenie dog. But so moving forward, I feel like I've heard you when you're talking to people that rushing out and trying to do a bunch of stuff is kind of a how do you transition? I guess that's a good question. How do you transition from, I've been in isolation and hyperstimulation quarantine for 2 years. I mean, I'm just blown away at how the links I've had to go to get myself calmed down. I mean, that's impressive.
Yeah.
I mean, wow, how messed up I was, and the links I've had to go to get calmed back down.
Yep. Yeah.
I mean, I'm finally sleeping okay. It's not great, but it's better. And anyway, so moving forward, I guess re-emerging into normal life, what's your advice on the transition? And then I have one more I have a question about the containment worksheet, and then I'll.
Slowly is the transition in. Take things slow. Don't be in a hurry. Like I mentioned earlier, one of the mistakes I see is people trying to jump in right away and go faster than the body's ready, or go faster than they're able to. Because when we duck out of life, there needs to be some reconditioning going back in, and that just takes time. This hip rehabilitation is a good example of, I want to walk right away, but my body's not ready. And so the same with hyperstimulation. We can't go further than what the body's able to do. And if you're still somewhat hyperstimulated, you have to integrate slowly and do things as you can manage them. Be aware of maybe some of the things that might crank things up a little bit, and sort of moderate those a little bit more. But as you reintegrate and as you keep working here, your body's going to settle back to normal health. And next thing you know, you'll be back into life full swing and doing much better. So it's doing things slowly and moderately is the key here.
We're not off to the races.
Nope. And even though we want to mentally, if the body's not ready, not a good plan. I mean, just an example.
Yeah, like I have all these medical checkups I need to do, and I've been forcing myself to go to the dentist the last 2 years, which was that just dug me in further with that. I shouldn't have done that, white knuckle it at the dentist, because I have teeth problems. I have to go every 3 months. But I put all that off to the side, and I thought, okay, we're just going to maybe one at a time, we're just going to read slowly, and
yeah. And it's so important to do things slowly. I mean, I worked with a client and was pretty much housebound, and as she was starting to move out and start to explore the city more, she wanted to go on a big trip. And my caution was, you want to take it small, expand your circle a little bit at a time. Don't, try to do 500 miles, tomorrow. Well, didn't listen. There was some pressure from family members, so she went on a big trip and had a horrible time because she wasn't ready. And so I see this so often. So again, the best thing to do is take it slow, build your confidence, because you have to build confidence. Let your body adjust, because it has to build some resiliency too. But if we do it slow and paint, a little bit at a time, next thing you know, again, we're back into the full swing. But it's got to be slow. There's no fast way to get through this.
So just really, okay. Well, that's the encouragement that I'm gonna do what you say and just ease on into her.
Yep.
Ease on into her.
Yep. You bet.
And then also the containment worksheet. That is probably one of my tools of Anxiety Center I don't use a lot.
Yeah.
Talk to me a little bit about the containment worksheet.
Well, it works differently for different people. Some people use it a lot. Some people don't use it hardly at all. From my perspective, the greatest thing we can do to overcome anxiety is address our fears. Once we realize that it's our mind that's scaring us, and we can imagine all kinds of things, no one's going to put a limiter on what we can imagine, so we have to do that ourselves. So once we identify what our fears are and we come up with ways to refute the fears so they're not fear-provoking all the time, then we use that as our containment. For example, a common one a lot of people use is, if you look after the third factor of fear, there's nothing I can do about it, or I can't cope with the outcome. Well, wait a minute, that statement is almost always false. There's a lot we can do to deal with the threat, because a lot of anxious people are super resilient anyway. They can deal with a lot of things, and we also cope with a lot of things. So we can deal with the threat in ways we don't think we can initially, and we can cope well with the after effects, even if the worst does come true. We're good copers. One of the greatest lies anxiety tells us, again, is that we can't deal with this threat and we can't deal with the after effects of the threat. Well, we can. So we underestimate our ability to deal with the threat. We underestimate our ability to cope with the after effects should they happen. So we always want to challenge that notion. So when we're, have our containment statements in mind as we're venturing into life, we want to be using those on a regular basis and replacing the lies with the truth. Again, a lot of us have been through, look at the stuff you've been through in these last 2 years. It takes a lot of, ambition and determination and perseverance. Well, surely if, difficult things come along, you're going to cope. You've already coped with probably some of the worst things a person can cope with. So we always want to be challenging that. So if we're going after our core fears, that's what eliminates anxiety. All the other stuff is just, helpful. So the containment worksheet, I think it's good at the beginning to make people aware of what they're thinking, what the threat is, where did the emotion come from, how can I flip that emotion and thinking. But as you do it for a while, it becomes automatic. So it has a place, and for certain people and in other people, you can do probably without it.
I have one more quick question for you, Jim. The meditation, when I first started, I would listen to these. I had some stuff I listened to and it really helped me. But over the last about, 3 to 4, maybe even 6 months, just in the afternoon, I just go have a little lie down. Yep. I don't even listen to anything. I just have a little, and I sort of feel guilty, like I should be listening to something. I just have a little lie down. Sometimes I fall asleep. Sometimes I don't. Sometimes I might say my prayers. Sometimes I don't even do that. Sometimes I just I have a little lie down. Is that good enough? Because I was so stimulated, it was like just having somebody talk to me just made me want to throw the phone through the wall. I just
yes.
Shut up.
Anything you can. I think anything you can do to relax.
Lie on my bed and just have a little lie down.
Yeah, anything you can do to relax the body is going to be helpful. We recommend deep relaxation because we don't fall asleep, because when the body's hyperstimulated and you fall asleep, what can happen is that the body can spike cortisol when you wake up. But when you're deliberately deep relaxing, you don't get that burst of adrenaline on waking up because you're awake through the whole thing and you're manually calming the body down, and you bring yourself out of that deep relaxation manually. So you skip that sudden burst of energy. But if you're not getting those bursts of energy and cortisol after naps are fine. Walks in the park are fine. Sitting in your backyard, if it's a nice backyard and quiet, is all fine. Anything.
Yeah, I do that sometimes. That sometimes. I'll go sit out in the backyard and I'll just sit in nature for a little while.
Yep. Perfect. Yeah, you bet.
So I don't have to be listening to a meditation.
You don't have to. Again, we do recommend it because it also teaches you mind control. We can dismiss things. We can contain thoughts we don't want. All those things are important for long-term recovery. But if you're doing it anyway, yeah, you can just do whatever you find is relaxing.
Yeah, because I was so hyperstimulated. It was like the sound of people talking to me was like nails on a chalkboard.
Yeah.
It was just like, I just had so many people for so many years just that I let just toxic waste trauma dump on me. It was like, the sound of people talking to me just drove me nuts.
Yeah.
I'm embarrassed to admit that, Jim.
Well, the body can only take so much, right? Sensory overload sometimes just is enough, and talking can do it.
Yeah. And I started, when I would listen to those meditations, it was just like, shut up, just shut up. That's how I would feel inside.
Yeah.
But yes, thank you, Jim. Thank you so much. And I'm glad you're doing better. And, Stacy's wonderful. And one more quick question. I'm a little angry with the medical community. Okay, I'm a lot angry with the medical community. The stuff I saw as a nurse, the ethical things I saw as a nurse, but also the fact that I had to, because I was Googling my symptoms, which I do not do anymore.
Good.
I came across Anxiety Center and I've been able to get help, but there was really no other place for me to get help in the medical community. I just was having all these problems in the medical community. I just feel like I've been let down by the medical community. I'm not angry at a doctor per se. It's the system. And I don't know, maybe the system's different in Canada, but.
No, it's the same. Yeah, it's not helpful for people with anxiety disorder if you're working with the wrong doctor, that's for sure.
Well, none of them are qualified to help with anxiety disorder. Most of the therapists shouldn't have that listed.
Well, we have doctors where we live here that do recognize what anxiety is, and their first recommendation is you need to get therapy. Go talk with a knowledgeable therapist. And so we are seeing a change here, but I understand that's not the same everywhere else.
Well, and it's not so much that I think many of the doctors do recognize it's anxiety, but they just don't have any knowledge of what it's going to take to get somebody out of They don't understand hyperstimulation of the nervous system. They don't understand nervous excitation or homeostatic dysregulation or any of those terms. They don't understand that,
No, they don't. Yeah.
It just blows my mind because the pain I was in and I have a little bit still kind of lingering on, but Jim, they'd have put me on a pile of pills and done surgery on me.
Yeah, I know. Yeah. Yeah.
It's just so sad. I'm that's part of the reason why I haven't gone to my checkups, because I think I have to work this out a little bit. I got to make my peace with this.
Yeah. Yeah. Well, it's not an area they're taught. That's the problem. And, because they come from the biological background, they think there's a biological fix. A lot of doctors, and because it's hyperstimulation, there's really not much they can give you other than sedatives, which we know, work very, very short term and then become addictive. So there's still an area of growth there. That's for sure.
Hey,
yeah,
Jim.
Well, thank you, Jim. I'll let you move on to the next, but I sure do appreciate you. And I was praying for you while you were sick, and I tell you what, you guys have been a godsend to me in so many ways. And I mean, it's even transferred into my family, and just, me taking charge of my health finally. And I mean, I don't know if you've ever seen the nurses' break room, but it's bad. It's, they eat everything. They eat everything.
Yeah, totally.
But
Yeah. Well, you're more than welcome. We're glad that we can help.
I've lost a little bit of weight, and I'm not anorexic. Just my daughter confronted me, and she's like, well, when does clean eating become anorexic? And Jim, this is the first time in my life I've ate 3 meals a day. I eat three healthy meals a day, and I got accountability, and I'm feeling better, and I'm still losing weight. So
good. Yeah. Awesome. Have you ever thought of working with Liliana?
Yeah, I did. I did think about that, but what I'm doing is working, so I thought I'd save the cash and just keep doing what I'm doing.
Yeah, and I'm not saying that you're doing anything wrong. It's just that Liliana worked with my wife and I, and we thought we were eating really healthy until she talked about things we had no knowledge of. She's extremely knowledgeable on nutrition, food combining, matching food sources to body types and how the body burns its energy. Made a world of. In fact, my wife had gone through extensive medical testing because of her digestive issues. She went everywhere, genetic testing, everything, and no one could come up with answers. It was Liliana that figured out what was going on. So she's really good. And so if you have any kind of dietary things that you're thinking about, you might be worth connecting with her.
Yeah, if I start seeing a need for it, I definitely will connect with her, because she probably would be great, because she knows about the hyperstimulation. Yep. My stomach stuff is doing a lot. I'm doing a lot better. I'm better than I've been in a very, very, very long time.
Well, that's good to hear.
Really want the hyperstimulation to go away.
Yeah, no kidding.